Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Right, wow. Tell me what's going on with your hip. What happened?
Yeah, it's just been injured for a very, very long time, and I've sought all sorts of help.
Mm-hmm.
You know?
How long that been going on?
I would say, honestly, the last maybe 6 years.
6 years.
It's only been really aggressive in the last 3 years.
3 years. So you injured 6 years ago.
Yeah.
How did you injure it?
Yeah, most likely sporting injuries, cumulative over the years. Tennis, basketball, soccer. Yeah, I've played a lot of sports. Yeah.
So a lot of sports.
Yeah.
Okay, so you injured your hip 6 years ago. The last 3 years you've been having a lot of issues with it. Okay. How much you feel pain there, and where do you feel the pain?
Yeah, mostly in the groin here.
In the groin area. Do you feel it in the joint or the muscle or both?
Both.
Okay.
Yeah.
What kind of treatment did you had before coming here?
So, yeah, all sorts, like acupuncture.
Acupuncture, okay. Massage, okay.
Physio.
Physical therapy,
yeah.
okay.
Chiropractor. Yeah. You name it, I've been through the rounds.
Okay, so you basically did everything in the book.
Yeah.
Okay. So what's difficult for you to do, and how much pain do you feel with what you're doing?
Still,
from 0 to 10.
Yeah, I mean the worst is the abduction. Is it or abduction?
Internal rotation here.
Yeah.
Okay,
yeah.
and flexion. Okay. So let's do the motion that's aggravated, and tell me from 0 to 10 how much pain do you feel there?
So that.
How much from 0 to 10?
Probably about a 5.
Where do you feel it?
Right
in the groin area.
Right in the groin.
So flexion 5 out of 10. Okay. What other motion?
Yep. So when I lift it up, and if I just rotate
it,
or any
external rotation, inward. Okay.
That would just pull me and just want to make me.
How much for 0 to 10?
It's about a 6 or 7 now.
6 or 7. Yeah. Okay, so it's increasing this way. Outward is okay, or the same?
Outward's kind of the same at the range, maximum range. It would
very
pinch
tight.
me. Yeah, it will pull, and yeah, probably about a 7 as well.
Okay.
Yeah.
So flexion, internal and external rotation.
Yeah.
Let's have you stand up because you were mentioning you had issue with the squat. So we'll have you squat down, and we'll see how that feel. From 0 to 10.
Probably this is probably my best. If I wasn't.
How much do you feel pain with that?
It's very unstable and weak, and yeah, it starts pulling it
from your IT band.
Yeah.
Okay. So squat, flexion, internal.
Right there, that's my max range, and that would about a 7 to 8.
7 to 8. Okay.
Oh, and I just want to fall over. From there.
Don't fall here, okay? Not in the front of the camera, okay? All right. So we'll have you walk back and forth. I want to see your gait.
Okay.
And let me know if you feel any pain. Is your hip usually catch on you? We'll go back and forth this way. Yep. So you have been walking like this for the last 6 years or 3 years?
Yeah, the last 3 years. Pretty much the last 3 years.
You're very stiff.
Yes.
Yeah. You see, you're limping.
Yeah.
Wow. Okay. So, any pain with that?
There's no pain, thank goodness, but I just feel it's heavy.
It's look like you're walking like a robot. Okay, we're gonna work on that. Where are you coming from?
Because Melbourne, Australia, all the way from Melbourne, Australia.
Where is that?
You don't know where Australia is, Doctor? No.
Australia?
Yeah, Australia. Yeah.
You coming from Australia?
All the way from Australia.
Welcome to California. How long is the fly?
16 hours.
Oh my goodness! Welcome. Yeah. I thought like some place in California, because we have like weird names of cities. Okay, so you guys have a winter now there?
Yeah.
Australia, welcome to California. Yeah. Okay, so if there is no scar tissue, it should feel like nice and smooth like this.
Okay.
When you have a scar tissue,
it should be grinding.
You feel that bump here? You see that? You see that?
Oh.
That's a scar tissue.
Yeah.
So our muscle should act like a rubber band. When you contract and relax and stretch like this. So when you have a scar tissue, it's like you have a knot in the rubber band. So when your muscle contract, it does not stretch much. So that's why you have a lot of muscle spasm there. Are you a healthcare provider or?
No, just private, yeah.
Is that too much?
No.
But you feel all that scar tissue here?
I definitely feel I've worked on it before. Even, I got my...
Get the foam roller and
everything.
Hammer and chainsaw. Nothing works. Okay. You feel that grinding here?
Ah, yeah. It's
okay. All of that scar tissue.
Yeah.
And here, you feel that? Sorry. Is that painful?
No.
It's okay.
Yes. Yeah, normal. When you go deeper, yeah.
Is it painful or just pressure?
No, just pressure.
Okay. Pressure is okay. Pain is not okay. Okay. You should feel pressure. That's part of the treatment. How's that?
Wow. Yeah.
Any pain or it's gone?
Yeah, almost gone. I mean, it's just a dull kind of pull, but that restrictive pain is not there.
So you feel pulling, not pain. Is that correct? Okay. Yeah, you're gonna continue feeling tightness because it takes a few sessions to really clear up the scar tissue. Every time when you clear it, your muscle can stretch, the rubber band can stretch further. Actually, tightness is not my concern. That's just going to take a few treatments. My concern is the pain, the muscle spasm that you experience from the tightness. So let's do internal and external rotation, twisting in and out. How's that?
That's pretty good.
You were making faces before, right?
Yeah.
Okay.
No, that's
outside. How's that? That's going further, yeah?
Wow, yeah.
It's how's that?
Yeah, I mean the pain is gone for sure. Oh, at the end range.
Where do you feel it?
Right here, but
in the back?
Right here.
Oh, let's drink more water.
Yeah.
I'm serious. If you're dehydrated, you're probably gonna be, because when I break the scar tissue, I release a toxics and waste product with the process. It's like massage. So you want to flush it out so you don't get like soreness from those toxic. And try it again and see. How's that? You feel it or it's gone?
Magic.
This is not a holy water, by the way. Okay. Okay. So let's. I want you to stand up and let's do squats. Because you were saying you were imbalanced. How's that? And did you notice something?
Yeah, I'm not having to fear of grabbing onto the table. Wow.
You were grabbing on the table before.
Wow.
Wow. Do a couple of them. So suddenly your strength came back. That's not sudden. That's when you have a scar tissue, it weakens your muscle. Your muscle is not stretching. When we break the scar tissue, your muscle contracts properly.
Wow, so simple yet
yeah.
So effective. That's amazing.
So let's walk. I want to see how you walk now. So suck your stomach nice and tall and just walk back and forth. How'd that feel?
Yeah, I like.
We definitely gonna work on your gait to correct it.
Yeah.
What I notice is it just
kind of like
we need to
swings out and.
No, here's the thing. It's a bad habit.
Yeah.
It's a bad habit. You still like have those like bad gait pattern because you compensating. So part of the treatment will teach you how to walk properly.
Okay.
You should land on your heel.
Yeah.
Heel to walk. Heel to walk like this. You land in here. Yep. Pick up. Yeah. We need to work on your right side too.
Yeah.
You're tight everywhere.
Definitely, yeah.
But any pain or it's okay?
Amazing.
Okay.
Amazing.
So you had chiropractor, physical therapy, occupational therapy, massage. You get the Graston tools. You had the trigger point nod, myofascial release. So can you tell any difference between everything and just ASTR treatment and the feet treatment?
Just it's so incredible. I've been watching your clips online and experiencing it firsthand. It's incredible. Just so simple, but so effective. Yeah. Now I truly understand. Okay, this is wow. So incredible. Thank you very much, Dr. Jacob.
Thank you, and welcome to California from Australia. I hope you use that as a vacation too.
For sure. Thank you very much.
Awesome. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to ASTRinstitute.com.